available, preferably under open content licensing models, and using that to improve the quality of the teaching and learning environment for our students. Now, in African contexts, that is really essential, because the simple reality is that faculties of health, colleges of health sciences are typically very seriously structurally underfunded for the work that they're trying to do. So if we come into an environment and start saying to people, we think it's really critical that you invest in producing better teaching and learning environments and making sure that students have access to better quality materials, which are not just textbooks, but also video content, computer-based multimedia, and so on, where we can create a richer learning environment. The management of those institutions and those faculties will turn around to us and say, but we don't even have the money to cover our recurrent costs of operating the institution. And so in that environment, the idea that groups of academics are going to sit on their own, develop their own programs and courses, and design their own teaching and learning materials from scratch simply doesn't make any economic sense. And so by bringing all of those things together, we believe that we start to construct a very powerful argument for why investing time and effort in producing materials under open licensing frameworks and harnessing the rich intellectual capital that is increasingly available in the OER space is such an important component of making sure that health programs are working effectively and producing high-quality graduates for our health systems in Africa. It's really those underlying philosophical principles that have guided the work that Catherine spoke about, and that increasingly now guide our desire to build a health OER network that involves not only African faculties of medicine and colleges of health science, but increasingly also their counterparts from all over the world. Because what we're really trying to do, having demonstrated the potential and the value of investing in producing effective teaching and learning materials by adapting existing open content, we're trying now to build a network of participants who increasingly are working with each other rather than having to work through a kind of project structure of the kind that we had to put together in order to make the proof of concept projects that Catherine just described very briefly work successfully. So our objective in creating a health OER network is to try to connect people who, on the one hand, have the need to gain access to high quality teaching and learning materials, and as Catherine's just highlighted, that need is not necessarily always a need in Africa. Very often African faculties of medicine and colleges of health science have access to a whole lot of teaching and learning materials about different aspects of medicine that are simply not accessible to people in the United States, for example. So collaboration is not necessarily, although people often make the mistake of assuming this, it's not necessarily always about taking materials from the developed world and making use of them in the developing world. The kinds of partnerships that we're constructing and that Tufts is constructing is about co-development of materials and sharing of materials both from south to north and from north to south. And by building a network of collaboration, we're hoping that as people express needs, for example, at the University of Malawi, the College of Nursing expressed a need for a series of materials in pre and postnatal birth for its nursing program. What we were able to do is, through our emerging network, send out a request, in this case by email, and request other universities to share whatever materials they had available. We found that was important because the existing OER repositories that are out on the internet didn't actually have any useful material in what was quite a specialized subject area. But by having constructed the beginnings of a network, we were able to put out the request for materials, and very rapidly we were able to get responses from both the United States and other parts of Africa, where people said, these are materials that we have available, and we'd be very happy to share them with the colleagues in Malawi. What we're trying to do in the next phase of building a network is create an environment in which that can happen without our intervention, where people who have those needs can communicate with an increasing and growing network of other faculties of medicine, other colleges of health science, and express those needs and find responses to those needs, where maybe on the one hand someone says, we've got a whole lot of materials that might be useful for you, or on the other hand, another member of the network might say, we share that need as a common need. Why don't we collaborate in producing something together rather than doing it independently? So what we're trying to do is we're trying to create what will be a voluntary network. In other words, we're not trying to create something that becomes a membership-based association that you belong to. It's something that anyone can participate in, something that harnesses the social networking tools that we've seen develop over the last 4 or 5 years on the internet, and that we've seen are incredibly powerful in mobilizing social participation in different kinds of initiatives, where the driver for the sustainability of the network will not be a donor-funded project, but will rather be the collaborative activities of the members of the network themselves, and that they will sustain that and keep that activity moving forward, not because there's some specific project targets to meet or results to deliver, but rather because collaborating with their peers from around the world is creating opportunities for them to respond to the needs that they have in their own institutions, responding to the challenges of producing high-quality teaching and learning materials without having to pay the kind of licensing costs that are associated with proprietary materials in this space of higher education. And as a result, get their job done. So what we're trying to do is to focus the activities of this OER network on helping people to be able to do their job more effectively, more productively, and at lower cost than if they were to try and do this work themselves. I'd like to highlight that, and this comes back to this issue that certainly I heard in the last presentation that I was participating in just before lunch, is that people always talk about the sustainability of OER initiatives as if this is a financial problem that we need to solve. In our experience, the fundamental problem is actually the problem that universities, as a general rule, certainly in Africa, at a structural level, see no real value in investing in the educational activities of their academics. And what this is most commonly found in its expression in the reality that if you look at the remuneration and incentives policies of universities, promotions and salary incremental increases are generally all driven in the environments in which we're working by research publication. So if you're an academic and you want to advance your career, the way you advance your career is by producing journal articles or presenting at conferences like this one. What we're trying to argue through the activities of this network is that we actually need to start making structural changes to those policies so that we place equal weight on the other side of the academics activities, the teaching and learning activities, and ensure that policies within institutions reflect the importance of investing time and effort in the design, development, and implementation of effective teaching and learning environments, a critical component of which is making sure that students have access to the right kinds of materials that they need to work their way through the program effectively. And it's really that challenge in my mind that is the key sustainability challenge. If we can persuade people through these kinds of networking activities, and if we can persuade institutions that that investment is important and that it should be structurally integrated into the operations of the institution by changing policies to reflect the importance of developing good quality materials, then we think it's really easy to persuade people that doing that using open licensing models is massively more cost effective and productive than having academics work in isolation and produce materials to which they retain the copyright and over which no one else has the rights, or to which no one else has the rights of adaptation. Because we would argue that the last 10 to 15 years of development of ICT has demonstrated absolutely unequivocally that those kinds of open models of sharing and collaboration are massively more productive and cost-effective than the old, traditional, copyright-based, proprietary models where people hold onto and hide their intellectual property. And in any event, an institution that premises its future on controlling that intellectual property through traditional copyright regimes is placing itself at serious risk because of the reality that sharing digital content has become so easy. So really what we're trying to do in the Health OER network is give practical expression to those ideas by connecting people from all around the world, focusing their attention on the really critical challenges that exist in African health systems to provide good quality materials at reasonable cost to help to drive health education on the continent. So I hope that gives you something of a sense of what we're trying to do. It's very ambitious. We don't believe that we've yet cracked the nut of how to make that all work successfully. But what Ted is going to do is now talk a little bit more about some of the successes that we've had so far in the collaborations that we've created, and how we believe that this creates, hopefully, a platform for greater levels of collaboration to take place through the network.
So the important thing we're talking about here is we're building a network. And one of the advantages that I have found in working with OER Africa is, as Catherine pointed out, they're working across a number of different disciplines. And so we're looking for ways where we can learn across these disciplines, share infrastructure, share lessons. And one of the important things about this is that we're trying to do this OER development not by partnering with individual lecturers, but really partnering at an institutional level, because then the benefit really pays off on a scale that's otherwise not achievable. In order to get started, though, we have to raise awareness. And one of the things that we did was we would hold sensitization workshops at the various campuses around policy and around OER development. And Catherine and Neil will talk a bit more about the policy side. But I'll mention the development side, the OER development side. Here's an example of a picture we had from the University of Ghana, a workshop we held in just over a year ago. And one of the interesting things about this, too, is that the participants here show lecturers from various schools, public health, dentistry, medical school, but there's also students in the room. And this is not a dialogue we often have at our institutions about where students are at the table talking about the creation of learning materials. And one of the things that was revealed here was what some of the lecturers were talking about, some of the deficits they had in their own skills or resources they could turn to at the institution. And the students raised their hand and said, well, we have the ability to share materials by passing around each other, or we can do flash development and create the materials. And so we're starting to tap into a variety of resources in the institution that, like Catherine pointed out, were previously unknown or not even realized. Oops. So the production workshops we held, we tailored them to each individual institution. It's because institutions may be at different levels in terms of creating learning materials, already having some of them have OER or online material production. But to use an example here, we did a 1.5-day workshop at the University of Ghana where we started off with an OER overview, and then we talked about the life cycle. So OER, as we know, is not something you can create once, put up online, and it can be distributed and live on. There's a life cycle to improvement and enhancing, taking back changes others might do. We spent time talking about copyright analysis, both in terms of the building blocks you use for your own course as well as the materials that you make available. And we talked a lot about packaging and distribution formats. And that's been very important to us, is we want to make sure the materials are available in editable formats. That distributing them as PDFs make it very difficult for someone else to take and translate or adapt, modify, and then redistribute these. So we want to make these available in a variety of editable file formats. And then we talk about open repositories. Some institutions already had open repositories for putting their materials, others didn't. And this is the advantage, again, of working at an institutional level, is instead of talking about a repository for the health content, separate from the repository for agriculture content, we could talk about institutional repositories emerging to support all of the open content activities. And then we would finish the workshops with an actual action plan. One of the things we did here, showing some of the benefit of the network, was that before we even had these workshops, we did a preliminary survey of what the needs were. I think Catherine talked about the gap analysis in the curriculum, so that all the institutions that were participating got to see what others were also interested in. And so they could also start talking about whether their component may feed into the broader picture or possibly down the line collaborating with others. One of the interesting things we found about these workshops is that the combination of us went and did these original workshops. These workshops have been sustained since then by faculties within the existing schools to take these, going from a sort of a train-the-trainer mode to people progressing from that point on with delivering their own workshops. So as I say, the aims here were to focus on the need-driven priorities within the local curriculum. So, it was not necessarily being altruistic from the beginning, but once you have that, then you can think about sharing learning materials globally, leading to local adaptation, enhancement, and republishing. So really building this virtuous circle that is really the promise of OER, is licensed, editable formats that are distributable on the internet. Now, one of the things we talked about in the development of the workshop was the tools and templates for creating these materials. The goal is to try to keep the technology very, very simple. We had an external assessor come in, take a look at the project, visit all the sites at the end of the calendar year, and interview students, members of faculty, administrators about what worked and what didn't work. And one of the interesting responses to the interviews was that there was originally a lot of concern there was going to be a significant hurdle that lecturers would have to go through in order to start creating and authoring materials. And when they saw, not just by us standing in front of a room lecturing, but actually in the class, we had people creating materials right there, they could see how approachable that was. So we showed some examples of very simple HTML-based templates for case studies that can be made available online, CD-ROM or on a web server, but also the materials can be printed off too. Again, the context with which we're dealing, it's important to have materials available in multiple formats, both print and electronically. And then there's a lot of interest in the health sciences. We're making materials available with video, surgery videos, procedure videos, and what we showed was you could do things with very simple cameras. So we brought the flip cameras, which are somewhere around $100 US, and showed that those could actually be very productive in common lighting situations with a microphone built into that device to capture materials for learning environments. And then also lecture capture, we found that a lot of lecturers are already using laptops. And what we showed them to use is using tools such as Camtasia, which record the PowerPoint and the lecturer speaking while the PowerPoint slides are turning, and create a file that can then be distributed. And so we had lecturers doing that right there inside the workshops. So again, they were finding that the actual tools were really quite approachable, and building again a set of materials that could be used and distributed more broadly. So Catherine already touched on this part, and it's this issue of intra-institutional collaboration, and that is connecting with local resources. At KNUST, so this is Kwame Nkrumah University of Science and Technology in the middle of Ghana, there's a Department of Communication Design with graphic designers, artists, who were available to help the College of Health Sciences, but the College of Health Sciences wasn't even aware this group existed on their own university campus. And as Catherine said, the activity that this started that dialogue across the institution, and we've built partnerships up across College of Health Sciences and this department. So in a way that, again, other OER programs that come up can also be available. What the Department of Communication Design wanted to be is an OER resource for the entire institution. One of the other things we looked at was the role of students. One of the things that we've been doing in Michigan from the beginning is trying to lower the cost of OER production by using more and more students involved in the process. And in the Ghanaian context, we had an interesting aspect to that, is that after graduation, students are required to do almost nearly a year of national service. And one of the things we proposed was that students could actually be doing that national service by participating in the OER production process. And that turned out to be an effective way of getting student engagement, again, from multiple departments. So we had, for example, national service students in the clinical setting in the hospital, but contributing to teacher education material development. Now, one of the things that we had also benefited from was that Dr. Carrie Engelberg, who is a physician at the University of Michigan Medical School, whose specialty is in infectious disease, spent a year in sabbatical in Ghana. And what this helped was to demonstrate how easy it is for someone who is a practicing clinician, but also committed to education, can create these learning materials. Again, there's a perception that the tools would be too complicated, that you had to be an ICT expert in order to do them. And by Dr. Engelberg's practice and engagement, he was able to show how he was using these materials to create learning materials at Michigan. And he was able to start then working with other lecturers at these institutions to create new materials. And as you heard, many of which for the benefit of the University of Michigan, and then more broadly, because they were dealing with specialty diseases, tropical diseases that our students at the University of Michigan need to learn about, but there's not a readily available high quality sources of these materials coming. So this made a really big difference in terms of being able to support that. Now, the challenge we have is that we don't have faculty members at all our institutions going on sabbatical in each location. So one of the goals of the network, as Neil was saying, is using some of the social networking tools that can probably supplant some of this physical presence and show the connection among the lecturers at the different institutions so they can work together, see each other's examples, and look for people to try and find ways to work together. One of the things that Neil talked about was this query went out from Malawi about materials that were needed for nurse midwives. And the question, there's multiple responses that could possibly come from that. One was, the examples he gave were they came off the shelf, materials that could be available and shared with others. Another possible answer might be someone say, I'm actually working on that right now, I'll be happy to make it available to you when it's finished. Another answer would be, I'm interested in actually developing these materials. Is anybody else interested in also working with me? And we have found that to be true. So for example, in obstetrics and gynecology, we have found some lecturers at different institutions who want to create procedure videos and training videos at different, from prenatal to postnatal care. And by combining that sort of the curriculum planning across all of that, they can work on their pieces and bring together a whole as an end result. And that's an example of a collaboration that's being constructed within Africa. So again, that's the advantage of some of the things we're trying to do within the network, is make these infrastructure available for this kind of communication. One of the things we want to get some reaction from people about is the generalizability of this infrastructure. That is both the technical infrastructure and the policy infrastructure. Once we create these materials and put them online in our repositories, for example, how easy is it to find them? So one of the things that we're working on is a search and discovery process, so that these materials, and when they're put up, can be easily found by others who are looking for them. Again, not being mediated by going through any coordinating office that we may be staffing, but by peer interaction. Well, we knew we didn't want to create a search and discovery process that was specific to health sciences, that we might lead someone else creating exactly the same kind of infrastructure for another domain. So we've been talking to, for example, the agriculture network about how we can invest in a common search and discovery process, sort of search engines. So even though they'll end up, what's delivered will have a label on one that says health content, another one agriculture content, but everything underneath that will be identical. So again, that's another advantage of working across with these networks, is we can pool together resources for common infrastructure components, and there's no benefit to duplicating work across the communities. So results. So at KNUST in Ghana, one of the things they've done is they've brought up a repository on their campus. This happens to be a Moodle server that they've put all the materials they've created there at KNUST, as well as the materials created at the University of Ghana. These same materials we're making available in multiple locations. So we do have them also, as you heard, on the OER Africa site, because we want to make them as available as possible. And there's an example of materials created collaboratively between Dr. Engelberg, who I said was on sabbatical, with Dr. Opari Sem from KNUST. And these are just were very simple HTML-based templates for creating materials. And these are case-based examples. And so this one right here, on the left side is an example of some reading material for the students, some data that may be provided to them. And the materials here on the left, in various cases, these could all be printed out. So we could give students printout of books, and they can get to all the same resources, or they can interact with it online. In here is a variety of information for them to understand the case, but also some formative assessments so that students going through it can take these mini quizzes and find out whether they're actually learning materials in the self-regulated learning model. And then the students can actually, if they find they're getting some of these quizzes wrong, again, this is all self-reporting, can go and get into more deeper materials, either to learn more about it, to raise their formative assessments, or because they're maybe curious about it. Some of the resources that are available to them, including little video clips. And I said these are very, very simple clips where just using, again, a very inexpensive camera, recording a lecture and just asking that lecturer a question about the current case being presented, and they would give an extemporaneous 4 or 5 minute explanation, just like the student would experience if he or she was walking down the hallways of a hospital and wanted to ask an attending physician about the same situation, but here in an interactive way. And what we're finding is this sort of building block component makes it easily adaptable across different environments, so that some of the components on the left-hand side are sort of very standard medicine resources, but we have the ability to augment it and tailor it to the local environment. So that describes, again, how we raise the awareness of the development infrastructure for the communities in the health space, how we're learning a little bit about how the commonalities that we have found in our space can also be built upon in terms of other disciplines. And then once we make it available, search and discovery, adapt them, and then improve them. I'll turn it over to Mary and talk a little more about her work in Tufts.
Okay. If you think back to my earlier slide when I was talking about Tufts' collaboration with folks in East Africa, the system that we shared with them in which they could co-collaborate content with us and with each other is the system which we call Tusk, stands for Tufts University Sciences Knowledge Base. And very, very briefly, it's basically an enterprise level curriculum and knowledge management system. I'm not going to go into any detail here. Actually, at 3:30, I'm running a workshop with Anand Zachariah and Thomas Ram. If you could stand up, our partners from Christian Medical College, and we're going to be going into detail about the system during that workshop, and they'll also issue you passwords so you can play within the system actually that they're using in India. But the key things about it is that the system is designed for the health sciences. We're moving to open source. There's just been much demand for the system, and we want to be able to work with anyone who would like to use the system. And we're also, interestingly, moving into non-health areas because people are seeing the value of the system. Even though we designed it specifically for the health sciences, the structure of it really can handle any kind of content. And so people are seeing that the power of the platform actually can be used in other areas. And in the last couple of years, we've been working on accessibility from any mobile device, and that also is up and running. So the partnerships that we have right now, number of institutions in the US have been using it for several years. University of Hawaii actually started using it when they went to 100% problem-based learning curriculum. They've now moved back to a hybrid curriculum, but the flexibility of the system allows it to really adapt to any kind of curriculum. New medical school that just has come on is actually Emory and Albert Einstein in New York. We recently just spoke to the New England Consortium of Medical Colleges. They have about a dozen medical schools and 5 dental schools. And interestingly, that cluster of medical schools, to me, is very much a microcosm of the medical schools in the United States. When you look at all of their schools, they use all of the systems that are currently available, including Tusk, including Sakai, Blackboard, Angel, Moodle. And it was very interesting talking to the consortium because they were able to talk about the things that their systems didn't do and what this one does. So that's why Albert Einstein has just recently signed on. We just spoke with that group a month ago. Here are our folks in East Africa. Recently, a group in Saudi Arabia is now implementing it, and our partners in India. If you think about how we have been using it at Tufts itself, those of you not familiar with our university, we have a medical, dental, veterinary school, and school of nutrition. All of those schools use one system that is supported centrally plus through cooperation across the health sciences. We have clinical sites across all of New England. The two main academic centers in the state of Maine, both are Tufts affiliated hospitals. We support several thousand faculty across the New England area. And dozens of hospitals all on one system. And in India, we have been partnering with Christian Medical College in Vellore, India for the last several years. We actually have a 40-year partnership with them around infectious diseases research, but just in the last 3 years we've been partnering with them in education. And I think that's a wonderful illustration of what's been discussed here in terms of the importance of institutional partnerships and collaboration, faculty to faculty, and the richness of those relationships, building on the richness of those relationships to continue to create content. And our faculty have been collaborating with the Christian Medical College faculty, our biochem faculty with their biochem faculty, our anatomy faculty with their anatomy faculty, our surgical clerkship faculty with theirs, et cetera, and they're sharing ideas, sharing content, and at the same time, Christian Medical College can create content that's very specific to them, to their needs. They now are able to support the entire system on their own, and with just very little advice from us. And they have moved now to supporting their network of over 200 mission hospitals across all of India. And as I mentioned, we'll be talking more about the specifics in our workshop later. Let's see. And another piece, this is the advantage of a conference like this. We had started some email discussions with OER Africa about the possibility of CMC sharing its content with institutions in Africa. And through this conference, we actually can meet face-to-face. And those are some of the discussions that we will be having as part of this meeting offline. To start talking about South-South collaboration, and Christian Medical College faculty have generously agreed to share their content openly, and we'll be discussing specifics about the best way of sharing content from CMC with institutions in Africa through OER Africa. Another outcome of our work has been the recognition of that hub and spoke model and the power of that model. So Tufts has recently been selected as one of the participants in the USAID Respond initiative. It is part of a $500 million global initiative to address emerging pandemic threats. And so for those of you who are not medical, that means all the diseases that jump from animals to people, things like HIV, things like the avian flu, things like SARS, and we are part of a group that is dealing with the Respond portion of that initiative, which is $180 million over 5 years, to give you a size of the scale of this. And what we will be doing is we will be using our Tusk infrastructure and helping to create regional training centers in the Congo Basin, the Gangetic Plains, Southeast Asia, and the Amazon Basin. And each of these regional centers will be comprised of partnerships between institutions that will then think of them as the hubs of those regions, and they will be able to reach out in a hub-spoke model to training people on the ground in villages, in local clinics and regional hospitals. Moving forward, there has been great interest, as I mentioned, in Tusk moving to open source. So we actually just had our first meeting a few weeks ago with partners from other institutions that would like to join us in open source development of Tusk to continue its development. We also have been talking with University of Indiana. They have developed an open medical record system, and they're interested in looking at the potential interface between OpenMRS and Tusk so that you could have a combination of a learning training system combined with the clinical system. So you could think of people working on the ground, taking care of patients, identifying a learning need, and being able to tap into that all in the same system. And the last, these all got out of line somehow, but the last thing is Tusk and Sakai. Some of you may know Sakai as learning management system open source platform, and we are also talking with them about how Tusk can interface with Sakai. Again, because many institutions are moving to open source, but there are very specific needs in health sciences that we can address. And rather than reinventing the wheel, we're talking about how those systems may be able to talk to one another so we can move forward more quickly.
Okay, I'm going to try and pull this together by just explaining very briefly, I hope, what then the concept of the network is, and using what we've described as the OER website, but it's actually a bit of a misnomer, as an explanation then for how the network relates to the kinds of things that Ted and Mary have spoken about. What we find in African contexts is that there are literally hundreds of these kinds of initiatives taking place, many of which are funded by donors, some of which are funded by governments, and some of which are funded by institutions. And the goal of the network is not to try to take over or replace the kinds of excellent work that Tufts is doing with its partners around the world, or the kinds of excellent work that have happened in the context of the Michigan partnerships and collaborations with Ghanaian institutions, for example. The goal of the network is to try to pull those things together into a common conceptual space so that the results and the value that is being created in those separate initiatives can be pooled and shared by a global health community. Now, what we think is essential if we want to achieve that somewhat abstract goal is that we don't make the network very heavy in the center. One of the major reasons why collaborative efforts fail is because the collaborative efforts put a lot of emphasis on central structures that take responsibility for managing membership and quality control and all sorts of other kinds. We think that that belongs most logically on the periphery, within the initiatives that are taking place and that are already doing that work. And that what simply needs to happen at the network side is to create the additional value that is going to justify people being part of the network rather than just carrying on in their own initiatives. So a first key value people are looking for, particularly if they are relying on government or donor funding, very often they want to be able to demonstrate that what they're doing is going to have an impact beyond the specific initiative in which they're involved. And so what we're trying to construct, using at this stage the OER Africa website as a vehicle for doing that, is simple mechanisms for people to be able to take the result of collaborative content development work they've been doing and push it out through the infrastructure of the internet very rapidly and very easily so that other people can easily find what they are doing. In order to do that, we have to accept that we have to let go of the control of content, which people find very difficult to do. But what we're trying to do is to create a kind of infrastructure, if you like, within which institutions can build their own repositories and store content there so that they can showcase it for the world. But simultaneously, without lots of effort, they can take the metadata that they've generated for their content, push it into the Open Courseware Consortium website, for example, or into OER Commons, or other places where metadata resides, without having to build big structured relationships to do that, where they can easily know that, for example, search facilities like the emerging Discover Ed search facility that Creative Commons is constructing, and there's another one called Folk something, I've just forgotten the exact name. But then increasingly what we hope is also the mainstream commercial search engines like Google and Bing and so on. We've begun some discussion with Google in this regard, can easily index the material that's contained in institutional repositories, and make sure that when people are running searches through those facilities, they will find the content that has been produced through these kinds of initiatives, which is often a major discoverability of what people have produced is a real major problem. We're also then trying to build redundancy so that, for example, where institutions don't have the capability to host materials and content themselves because maybe they lack the financial resources for that we can build some structured relationships with one or two key institutional partners, starting with the University of Michigan, for example, but we're also having a conversation separately with the University of Nottingham about the same process, that actual content that's been produced through these collaborations can find alternative hosting locations, so that rather than just storing the metadata, the actual content is being stored in multiple places. So that if one initiative fails, it doesn't mean that you lose all the content that's been created. We build redundancy in by actually wanting to host content in multiple locations. And then we use social networking tools, like Facebook, for example, and Ning, and various other third-party applications, to publicize the content. That we go out and look for existing networks where people are already talking about health education. So we don't build separate discussions. We actually go in and infiltrate the existing networks and use those to raise awareness about what's being produced. And so that the network becomes a decentralized facility through which people can raise very rapidly awareness about. And part of the reason why we believe that's important is that we believe that once these kinds of collaborations have taken place, it very rapidly becomes the case that content gets lost on the internet. And so if you want to give it a life, you have to make sure that people can be aware of its existence and that awareness can run very rapidly through the infrastructure, the OER infrastructure of the internet, rather than just putting things in one place. So a key component of the network logic that we're trying to build is to have a decentralized mechanism for spreading content around the internet rather than trying to host it in a single centralized location. It's quite an abstract concept, but we think it's really important to an important way of ensuring that the great kinds of value that has been created in these collaborations can start to get new lives beyond the initial collaborative effort. The other key thing that we're hoping will happen as we start to do that side of work is that increasingly we'll be able to use those same online facilities and mechanisms to try and bring people together in a kind of OER marketplace where people who have needs and people who have the ability to respond to those needs can find each other online without lots of effort having to go into that location process. So we have in mind the idea of the network becoming a kind of OER marketplace where on the one hand people can publicize what they have, and on the other hand people can raise awareness about what their needs are, and we can hopefully start to find a match between that supply and that demand. And again, we don't see that happening necessarily in a single central location. But we think, and one of the reasons why we're here at this particular conference, is we think collaborative mechanisms like the Open Courseware Consortium will become a really important component of how we sustain the communication in this kind of network. So we don't see this network as something that OER Africa runs, or that University of Michigan runs, or that Tufts runs. We see all of ourselves as being part of that network, that increasingly more and more people come to join, but that no one actually owns. And that the reason they come and join is because they can, on the one hand, find people who can help them to solve problems that they have in their own institution, and on the other hand, by joining, they can find mechanisms to publicize and spread the results of what they're doing very rapidly and cost effectively. And obviously from an African perspective, a key point of entry of all of this for us is the existing projects that there are all over the continent, where lots of content is being produced already. And so a key mechanism that we're using is to actually engage funders who are already funding very significant health initiatives across the continent, and trying to persuade them to bring their projects within the framework of this network, so that we can rapidly increase the value that's available through the network without having to mobilize lots of new money. Because the money is already being spent, and the money is already producing excellent content and excellent resources and excellent ideas. The problem is just that that is not being shared across the more global community of health. And so by bringing those projects into this framework, by persuading donors in this instance that they should put open licensing models into their projects so that the results can be shared with this broader community, we believe we can have significantly greater impact from that same amount of spending, rather than creating a network which requires huge volumes of new money in order to sustain itself. So our long-term vision is a network which is sustained through the activities and investments of all of the participating projects and institutions, rather than one that requires a big centralized administration to sustain itself. Using the architecture of the internet and the tools and resources that are already there to sustain itself, rather than constructing new facilities that again demand new financial resources in order to be maintained. So that is really, I believe, and I hope Ted, Catherine, and Mary, I've articulated the philosophy underpinning the network successfully. And really what we wanted to do now is to open this up for discussion, because in the spirit of good networking, we hope that we have absolutely no monopoly at all on understanding what the right ways to achieve those objectives are. And so we're interested to begin a discussion about how that might work successfully. Ted, you're going to introduce some of the... so let's just go back to that one very quickly. Some of the things that we already believe are worth doing. We put a little declaration together, which is actually sitting at the moment on the OER Africa network. So one of the first things we're encouraging people to do is to go and sign that declaration. It's an electronic signature, of course. It commits you to nothing, fortunately and unfortunately, except that it's an indication of a principle or a willingness to participate in something. And at least that way, we know that we should be communicating with you because you have at least expressed an in-principle interest in some of the ideas that we think are important here. We're encouraging people to look for ways of sharing content. One of the key things we're wanting to do, as I've said, is to develop this concept of what I've just called an OER marketplace, where people with needs and with people who have resources that they want to share can come together and find each other. And we're increasingly, if you go back to the very early comment I made, we're increasingly, academics and institutions see that part of their future business models are going to come from sharing what they have. In other words, that if you're an academic and you want to build your career, increasingly it's by sharing what you have, by raising awareness of the fact that you have skills and competence to produce things, that you will build your career in this side of academia. And the same with institutions. We've seen the massive marketing effect that initiatives like the MIT Open Courseware Repository and OpenLearn at the Open University in the United Kingdom have had for those institutions. So there's a tremendous marketing potential that sits in this that we hope that people will want to become part of. We hope that you'll come and join discussions as those start to take place. As I said, those discussions won't simply exist within OER Africa or University of Michigan or Tufts or anywhere else. They'll be all over the place, and we'll just need to find connections to them. And then help us to build relationships and to bring those relationships within the framework of the network. Those are some of the things that we're trying to do and that we hope you might want to help us in doing. So let's move across to the discussion side.
Thank you very much for your attention. We did promise you an opportunity to ask questions as we went along, and now I realize that we didn't actually do that. So Ted is going to guide us in some discussion where we would like to ask you some questions. But before that, does anybody have any questions for clarification or any points that they would like to raise before we move to the final discussion in this session? Any questions at all from anyone at this point? Yes.
One thing that you mentioned was you want sharing, but you don't want peer review. And I'm wondering how you can kind of guarantee the quality of the content. I guess you're relying heavily on the network to kind of, I guess, review its content before it uses it. Is that correct?
I mean, what you're speaking of here, I think, is a broader issue that affects the OER movement as a whole. Sorry, we have to repeat the question for the recording purposes. So the question is that I indicated that we're not incorporating peer review as part of the function of the network per se. So the question is, how do we manage issues of quality? Where does that review process take place to ensure the quality of what is being shared is good? And I think the answer to that question from our side is that we don't yet successfully see any model that shifts the responsibility for quality control away from where we believe it belongs, which is still within the institution, within the faculty, and within the domain of the individual academics who are responsible for managing courses and programs. At the end of the day, that's where quality management has to take place. We think that there are lots of mechanisms that already exist, and they're in there in the existing OER repositories, where obviously peer review could happen, and that could be more or less formal, and we certainly wouldn't want to discourage that. I think we just don't see the network as performing that kind of peer review function, because then it starts to become a quality control system. It needs a whole lot of resources to sustain itself, so on and so forth. So what we see happening on the quality side is more relying on the power of social networking to perform some of the function of quality review. In other words, the content that gets shared and that gets used repeatedly and linked to more often is going to be the content that you're most likely to find first in search facilities. It's going to be what people will link comments to, indicating that they've enjoyed that content the most. It'll be the content that gets downloaded the most. So if facilities have the ability to tell you how many times a piece of content's been downloaded, that will give you some indication of the fact that that quality is there. So that you've got all those tools that give you guides to the fact that something might be a quality resource, but you don't create a system where quality control is happening at the center of the network. Instead, you leave it to social networking to perform some of the quality functions, and for the rest you assume that the responsibility still resides where it has always resided, which is within the institution itself, with the academics themselves. And in our case, also ensuring then that in parallel, in the kinds of project activities that we're talking about, you're actually building the capacity of academics to do that quality work themselves. Because certainly my contention would be that for academics to engage in producing teaching and learning materials using OER, it can be very productive. They can do things much quicker. But if they don't have good skills in instructional design, materials development, quality control, those kinds of things, then they're going to produce probably worse quality material than they would have started with. So an essential part of effective use of OER is building the capacity of academics within institutions in instructional design, materials development, quality assurance skills, which is something that still has to happen. We just don't see that as the responsibility of the network to deliver those services. I hope I'm making some sense.
Yeah, and to give a specific, so as he said, we don't want to make the network a gatekeeper for that. But from the health area specifically, for example, we're promoting the use of the Association of American Medical Colleges MedEd portal, which is a peer review structure, which 70 countries around the world are already contributing to and subscribing from, where faculty members who submit their materials there get a citation that's analogous to a journal publication. And then one of the things we try and do, raise awareness through our policy workshops, is that gives faculty members credit for promotion. But again, we facilitate access to that as opposed to trying to duplicate it. Other basic questions?
Teacher, according to you, touch programs developed in India, Africa, etc. Why don't they develop in Vietnam or in Asia? Can you explain the reason? And do you think touch program will organized in Vietnam in the future? Thank you.
Well, we are open to working with any country. I had actually at the OCW Consortium meeting last year spoke briefly with one of your ministers of education, and there's interest. It was not pursued yet. We're certainly open to that. As I mentioned, we're developing an open consortium. Really, anyone can talk with us. The rate limiting step for us at the moment is we have a very small staff, and each of our projects has been grant supported in terms of staff time to train people in the other institutions. So our work in India, for instance, was generously supported by an anonymous foundation. It's a 3-year grant that is about to run out. We were predicting at the beginning of that project that it would take us 5 years for it to be institutionalized at Christian Medical College. Actually, we're not even finishing 3 years, and the institution has already committed to supporting it permanently. So they just got funding for another year post-grant, and our expectation is that will be continued. And so the approach that we've been using is as groups have approached us, if there's a way to develop that partnership, we have done that, and our goal is actually to make that institution self-sustaining. We have worked in Asia. Actually, our veterinary school has worked in Indonesia, specifically around avian flu. They've been working with their 5 veterinary schools. And so with the Respond initiative, I mentioned that one of the areas that we'll be working in is Southeast Asia. So it's actually leveraging the prior work that was done in Indonesia, and I know that they're talking with other countries, which I believe is also Vietnam, to talk about which countries will be included in the initial regional outreach. But each of these things needs to happen in stages. What we're looking at are institutions that can form an initial hub, because it does take, as you know, some technical support, some user support. Not every institution has that. So what we're looking at is creating capacity in an institution that has that level of support. They can be the initial hub. We train the trainers there. So we train the faculty, train the user support staff, train the technical staff, so that they can maintain the site locally and train people in the region. And that seems to be working extremely well, and we're replicating that model in multiple sites.
And I can add an opportunity that I learned of yesterday. A group of us visited Vietnam National University, which is starting a medical school next year. And that medical school can make a commitment to be using open educational resources for both showing its own any innovations it's doing in the education process, but also doing the kind of requests that Neil was talking about to say, how are other people teaching this topic, and using those as either models or inputs to their own processes. So I think there's opportunities here. So,
Hi. At Open Learning Exchange, we're concerned about helping young children learn about health, nutrition, and farming. We're going to put those three together. And so I'm wondering, is there work, do you know of work that's being done that would be appropriate for the elementary level, particularly anything that's kind of activity oriented as just from simply knowledge?
Go ahead.
Sorry, no, it's not a real answer, but what we'll be discussing in the coming up workshop is right now we're discussing the use of OER in health. And as in Vellore, we have developed these resources there, and we, in a phase or in the development phase, we were connecting the resources to the secondary hospitals, which Mary told we have a network of about 200 hospitals. So it was just an idea actually we had discussed earlier. Is one of the main problems of keeping the healthcare professionals in these hospitals is adequate school education. So this is what I had mentioned earlier, is how about having integrating this primary school and secondary school or the K-12 education as an OER, so that it supports the education of the children, and ultimately it will lead that the healthcare professionals can stay on there. Otherwise they stay there till their primary school is over and they move out from that hospital. Yeah, so I mean, it's important that the whole family is looked after. So we are thinking whether it could be an opportunity for us to support that and make OER more meaningful actually. I hope I have clarified.
So regarding the sharing, do you have a standardized license that you've adopted, or that's the question?
Let me just make a follow-up comment to your question, which is that I think really the key logic of the network is to enable people who are in the situation that you find yourself to be able to put that kind of request out to people who are in a position to be able to help you without having to fly to Vietnam to find someone who comes from India to get an answer to your question, that we could actually use the architecture of the internet to facilitate exactly that kind of request process. So this for us is an example of exactly the kind of OER marketplace logic we're talking about. It is a sad reality in higher education that so much of what happens still is driven through these very traditional communication mechanisms. As a separate aside, things are not off the top of my head, but I know a lot of initiatives, NGO-based initiatives and things like that in Africa, certainly in South Africa, where I think there is a combination of those different elements that might be of use to you. So I'll give you my card and try and follow them up when I get back to Johannesburg and try and provide you links to those as well. But I just wanted to make the general point that it's exactly this kind of request that we're trying to find ways to drive through an online network rather than having to rely on traditional forms of communication.
Answer the question about the license. What we've been promoting, certainly with the University of Michigan, is the either CC BY or CC 0, so the least restrictive licenses, and because we want to see this brought to the most use. I want to see social entrepreneurs figuring out ways to make money to help duplicate and distribute these materials. And one of the things that Creative Commons has done, and if people haven't seen it, is a grid that shows the interoperability of different licenses. And as soon as people started putting restrictions and non-commercial or share alike, it restricts what you can use. And so that's when we push. And again, it's up to the lecturer, but we push CC BY.
I just give an example of something which hopefully will help to explain why we actually don't impose any kind of standard license in anything we're doing. Certainly in all of OER Africa's work, we also encourage the same simple Creative Commons attribution license, just because it has the least restrictions. But in the work that I talked about at Kamuzu College of Nursing in Malawi, when we sent our first request for content out to the network of partners that we'd built, we got a lot of responses. One of the best responses we got was actually from a university that supplied us a whole lot of content that actually wasn't open at all. It was proprietary content with normal copyright licenses and nothing extra added. The institution indicated they were willing for University of Malawi to use this content, but no one else. So we've been through the design cycle. the exercise of producing what's actually a CD-based resource, and this is video material that's on there. And I'm making up the numbers, but let's say they supplied us 100 video clips. In the end, we ended up using sort of 5 or 8 of them in this resource. What we've now done is gone back to that institution and requested not for the whole batch of everything that they had to be released under Creative Commons license, but we've come back and said, we just used these specific pieces. This is how we embedded them into a bigger course environment, and we'd now like to share that. Can you give us permission to share those specific pieces? And we're finding that the institution is open to that model of sharing, because it's not asking them to provide a blanket share for everything that they produced. It's just very specific pieces of content within a given course context. And so by not having tried to impose up front that we'll only accept content that comes under a specific standard license, we've been able to get some really good quality materials. We've solved a specific learning problem or need. We've met a specific learning need that existed in Malawi very effectively. And we've been able to contribute to the growing pool of OER by now persuading that institution to release just those few pieces of content under a different license from the license they provided it. So for that reason, the networking activities create no obligations for people to share in any specific license, because we think that that becomes quite problematic to the whole spirit of collaboration. I hope I'm not just speaking on my personal behalf there.
Okay, this is Angela Ho from Taipei. Okay, the Furan Catholic University, our school is a Catholic university, and we also have the medical school. So actually, I'm quite interested about your initiatives and your projects. We think because the Catholic University, our mission is to share everything we have, to help poor, to help anything, to anyone, okay, who really in need. But now in our school, actually, we have been involved in developing open courseware for 2 years, and from the top administrators, okay, has been invited to, develop to share their courses with it, not just on campuses, as well as, all the universities in Taiwan. But still, okay, my problems now I'm the director of the Faculty Development or Instructional Resources Center, so I'm helping develop certain kind of all the courses on the campuses. So the number problem is, though, like including our president, vice president, provost, they are all invited to share their courses. But still, okay, 95% of faculty members in Furan still worry about, first of all, about the time, second about the technology, though you mentioned about they should use the simple technology, but still, a lot of senior professors, okay, they are not used to that. This is the problems. And then also about the financial, okay, supports continuously. If we could still get enough, sponsors or what the fundings from the government still, we have to be granted by our government. So we think if Furan, okay, like join your network, I think, okay, and then also some training. We need some trainings to train our, our professionals to help our faculties and a lot of things. It thinks that our problems could be solved as soon as we join you. Yes, I'm looking for some solutions to help.
I don't know whether we can solve all of your problems, but we can certainly share some of the things that we have done. We faced very similar challenges to the ones that you've described in African universities. And one of the first things that we do is do some sensitization, so that we call faculty together and we take them through a workshop where they can ask those kinds of questions. What's the question that people really want to ask and that they might think is impolite is, what's in it for me? Why would I do this? And we take them through that. We help them to understand what OER is, what it isn't, what are the implications, what are the costs, those hidden costs that come up later, like somebody's time for developing all of those resources. We also help institutions by looking at their existing policy frameworks. So we look at things like intellectual property, materials development policies, if those are in place, and are people actually being given time? Is their work recognized to be developing open educational resources? And if it isn't, is that something that the institution would want to consider if it's actually committed? As you say, the people are committed, but they don't have the, okay, so how do we do it? What do we do next? And creating an enabling policy framework is a very useful way to go, because then the policies are in place to allow people to actually spend time and money in developing the resources.
The other thing I wanted to add is many of these institutions are research institutions, and so when faculty say they don't have time, it's because the reward system is around research. And so, and there is not the recognition for education. However, by partnering around particular projects, partnering with other institutions, faculty can pursue grant-supported educational initiatives and turn that work into educational scholarship. Particularly in medicine, there's growing recognition of what's called the clinician educator track towards promotion. There are many United States schools that have adopted a promotional process for faculty who are dedicated to education and pursue educational scholarship within education. And so it's become a viable track where faculty can get both recognized and supported and promoted by doing education. It's not enough just to teach. It's not enough just to create content. You do have to take it to the next level in terms of innovating, going after educational grants, doing collaborative projects, doing educational research, but we definitely have faculty who've been promoted with that, and I see that increasing across the U.S. anyway.
So the very short answer to your question is that being part of such a network will allow you access to information about how other people have solved their problems, their challenges, and for you to see whether you could use the same methodology or adapt it for your own particular case. There was a question over there from Professor Miyagawa.
Thank you. What strikes me about this panel is that although your title is Harnessing OER, what it seems to me that you're really harnessing here is the ability to collaborate across institutions of very different kinds. And the OER was in a sense a hook. But the real so the outcome that I see here, and maybe you're actually pointing at the future of OpenCourseWare. I'm asked all the time, what's next? And I think you may be pointing at least one of the what's next, and that is that through our collaboration with OER, in fact, we are collaborating as institutions that, I mean, Tufts and Michigan, OER, you probably wouldn't have collaborated on this, or the probability was not as great as when you started to think in these terms. And so I'm just very excited about this. I feel like I found something new about OpenCourseWare and OER. And Mary Lee mentioned that this is a model for other areas, not just for health education. And so that's the observation. But my question is, can you think of other areas where you could see such synergy, global energy? Because I really think you may be onto something here about what's next for OER and OpenCourseWare.
Just in response to your observation first, and I think that the collaboration is a really important component of what we're interested in. I try and be always a troublemaker when I come into processes and listen to new OER initiatives, particularly institutional initiatives. The first question I ask is how much content is being stored in your OER repository that is in adaptation of materials that were produced elsewhere. And I think it's actually a bit of an indictment on the OER movement that such a very small percentage of materials that institutions are using and sharing through their OER repositories reflects the philosophical principles on which the concept of OpenCourseWare is constructed, which is that we don't actually produce our own materials from scratch. We define a curriculum need, then we go out and we look for what's available, and we build on that to create new course materials. And we hope that the kinds of spaces of collaboration we're creating will take the OER movement or the open courseware movement significantly forward in terms of getting that to happen. Because until that's happening systematically, and then I think coming to the policy issues, until then, in parallel with that, institutional policies actually actively reward and encourage that behavior instead of discouraging it. Most intellectual property policies at the moment within universities, in fact, actively discourage people from taking and adapting other work. They encourage people to do their own thing. So when we shift those policies, I think then open courseware, through these kind of collaborative efforts, will start to realize its true potential. Until that happens, I think we're still getting too much of a supply model where everyone is sharing what they have, but not necessarily internalizing the implications of that sharing into the way in which the institutions behave. So that's just a response on the first part. I don't know if someone else wants to respond to the question.
Just, I think we're in agreement. What I'm quite struck by is the fact that these institutions, very diverse institutions, are now collaborating in ways that we didn't see before. And OER is the hook, but it's just a fact. We see it in front of us that you are doing collaboration, and this is changing what you're doing internal to Tufts and Michigan, I'm sure, as well. And so I don't think that we are in disagreement here. We may have slightly different views, but I just want to put that on the table.
The next step is that actually get institutionalized. Because the only reason it's happening here is because of funded projects. So we need to know that beyond the funded space.
I mean, I think I would agree that it always comes back to the people. You know, it's not the content. It's really about the human interaction and the human creativity and collaboration. If I'm interpreting your question correctly in terms of can this be applied to other spaces, you mean other spaces outside of health? Or, yeah, absolutely. I mean, this is really just an example. And I can tell you that the work that our dental school has been doing in Zambia, for instance, they've been working in rural Zambia. They went into a community initially through oral health, but that has turned into an extremely diverse community development project that ranges from helping to develop a women's cooperative so that the women in the village can earn extra income in addition to their farming, which is now supporting education for the children in the village, helping to start a fund for maternal child health, and you know, they're getting into, in addition to making baskets, they're now making beads, but that work has led to getting clean water, and so engineering was brought in. The fact that they have clean water improved the health of the village, improved the health of the livestock. I mean, it's just this chain of events that is a combination of connecting through a particular project, and I can give you examples of how each of our schools went into an area or a region through their specific discipline, but then turned into broader local development, where you then bring in, you know, all of the different areas, all of the disciplines, all of our schools. So when we're talking about, at least at Tufts, when we're talking about global health, it really involves all of our schools, not just medicine. And you know, if you look at the health of a community, it really requires every discipline working together. And I think that OER, the concept of open sharing of knowledge, you know, I think is just a very powerful model in terms of sharing ideas, sharing approaches, sharing training, which is broadly applicable. And you know, I've seen it happen, you know, time and again. It's not just about medicine, not just about health.
Neil, do you want to say something about how? Okay. In the previous slide, where we were talking about the OER Africa website, we had talked about the 4 domain areas of OER Africa being health, teacher education, foundation courses, and agriculture. In each of those areas, we're trying to work in a similar way, this idea of a network, and a network being cross-institutional, and we do think that this is a way forward beyond the donor-funded projects, which might be of a very short duration, whereas people's interest and people's needs continue beyond that lifespan. In the area of teacher education, for example, we are collaborating now with a project called Teacher Education in Sub-Saharan Africa. We were in a meeting last week called by the Teacher Education in Sub-Saharan Africa Network. There were several other small networks of African universities also working in the area of teacher education. And again, we discussed this sort of idea of how do you create a network of all of these networks so that people are able to share their needs with each other. What are the things that would hold such a network together? Again, looking at areas such as policy, such as OER sensitization, such as materials development workshops, because again, just because people are subject matter experts, whether their subject is health, whether it's teacher education, whether it's agriculture, it doesn't mean that they have the technical skills that would allow them to digitize their work, that would allow them to share their work. And very often, as the lady from Taipei pointed out, when people have been teaching for years and years, the last thing that they want to do is to feel exposed that there's this new technology that's out there and I don't know how to use it. So how do we get across that sort of a barrier? How do we let them, how do we, for example, look at existing ICT policies and ICT skills that already exist within an institution and turn that around so that faculty feel supported rather than exposed in using these new technologies? We think that these are transferable across not just those 4 areas that OER Africa happens to be working in, but actually any subject area, any discipline area. Because the minute that you get people from the same discipline talking together, their ability to solve each other's needs, to talk in the same language, as it were, is far greater than, you know, if you're trying to get people together just because there's a project. Ted, Neil, Mary? We're coming to, I think, the end of our session, so if there are any other...
I agree with everything that you say about having to put more resources behind faculty and teaching and that, but what's going to drive this is not specific, I think, networks like this being developed, but I mean, just look at what this morning Ted was saying. 50% of their faculty, it's a little better that for professorial faculty, don't even know at that university about OpenCourseWare. And so I think that when you get more visibility and then a powerful search engine that people can use to actually uncover open educational resources that they can then go in and look at, faculty will then start to use that and develop networks. There are disincentives for faculty to spend a lot of time in education. There's no question about it, because the government doesn't fund it in the United States very adequately the way it funds research. And so since most of the big universities are driven by research dollars, there's a disincentive there. But we're constantly looking to try and improve the way we do teach. And then there are those faculty whose balance of effort is shifted way toward the educational side. And I agree with Mary that at our institution also they can get promoted if there's scholarship involved in education. So I think it's going to evolve, and we really have to look at how to promote the awareness and the value of those tools.
I think certainly from our perspective, we couldn't agree with you more. We see these networks as supporting the work that people are doing, not driving it. I don't think it can be any other way around. But I do think that the other thing that we're hopefully doing, which I think relates to this earlier comment that you've made, in terms of trying to grapple with the OER value proposition and understand that, the first phase of creation of OER repositories is where institutions just share their content, was an important first step. It was prototypical in many respects, but it's also very limited in terms of its value proposition and its ability to raise awareness or persuade people of the value of changing behavior. What we're hoping is also happening here, and the observation that he's made, in a sense, confirms that for us, is that this is also prototypical, in a sense, of the kinds of models of networking and collaboration that can take place. So it's not necessarily going to be the case that what we're starting here will become the network of the future. This may evolve into many different kinds of networks, but what we hope can be possible, which I think is what funded projects can do well, is to prototype different models of collaboration and networking, put them out there, make them available for people to share, and hopefully stimulate an imagination that was previously not there.
That's right. Now you got to publish, the development of the network. That's right.
Another comment before we... Yes, I know. But I think there was another hand. No? Going on. Thank you very much, ladies and gentlemen.
My name is Daniel Hanss. I'm from Tufts University in network connection. And I might be able to help with one in particular, the taking it to the other places. One of the reasons I was asking about connection to the CCI license repository. But I work on a very specific project that's community outreach. So I'm interested in seeing the concept of how it might be incorporated into the connections repository, which could also help with visibility of these connections is really great. So we have really high search rankings. I've actually worked with some of the University of Michigan. I don't know the Chuck Seconds. Yeah, I actually, this is actually my business partner's car, but I talked to the she's on the back. So that's my phone number. Oh, well then you really get the